Hi, I'm Joe Kanerick from Safety, Security, and Emergency Management.
My name is Kiki and I'm a food service worker.
I'm Dr. John Varber. I'm the Chief Medical Officer at Bergen Newbridge Medical Center.
Christine Pendy, Behavioral Health Services.
Hey, my name is Joseph Murillo. I work on Unit F1. It's behavioral health.
What does the patient-resident experience mean to you?
I think it means just putting the patients first and at the center of everything. You know, when we think about how we take care of patients, the experience is not just what they experience in the moment, but what they experience afterwards and how that affects how they follow up, how they are able to follow any plans that you make with them. And to do that, you really have to understand what the patient is going through and kind of put yourself in their shoes. And so that, I think, is the key part of experience.
What it means to us is we try to facilitate, first and foremost, we're advocates for the patient. And we utilize all our resources that's available and curtail it to the patient and their needs. Every patient is different, so everybody's need is different. We incorporate compassion and empathy with that and attempt to facilitate their experience to be a good experience, no matter what their circumstances may be.
The patient-resident experience means the opportunity for us to listen to those that we care for every day, to meet the needs of our community by making sure that we are providing the services and care that they need and that we are responsive to what is happening every day in our community.
In your department, what are some of the ways you work to improve the patient experience?
We can work to improve the patient experience by actively engaging our patients, residents, and visitors each time they come through our lobby and are greeted by one of the security officers. Just with our residents especially, we get to see them on a very regular basis and engaging in conversations about them and how they're doing that day. Although we are not clinicians or caregivers, we have a genuine interest in their well-being, and that's a big part of the role as we're rounding and making the place safe and secure is engaging those around us in a positive way.
I'm on the train line, so I serve breakfast, lunch, and dinner. Sometimes I even bring the trucks up to the floors. I deliver, and I just make sure they're always well taken care of.
So it's very important for us to hear the voices of our patients that we serve every day. It's important for us to provide a compassionate and communicative environment so that we know that we're meeting the needs of those that are in our care. We do a lot of various different activities on our units and in our outpatient services. Most importantly, our patient satisfaction surveys, so that we know that we've provided the level of care in a compassionate and caring fashion, and that if there are things that we could improve on and do differently, that we listen to those that we've provided service to so we can make necessary changes.